I'm Shannon. I'm 40 years old and I'm originally from Seattle, but now I live in Washington, D.C. I'm currently the director of HIV/AIDS for Washington, D.C., and I've been in this job for about a year. After essentially the mayor hired me because our Mayor Fenty made HIV/AIDS his #1 public health priority, and I said, yeah, I want to be part of that response. And we have not just an epicenter, we are the modern epidemic. We have the highest AIDS rates in the country. We do have increasing rates, increasing numbers of women living with HIV/AIDS in the district. If you are HIV positive, there are a lot of services out there in DC, and there are a lot of people who would like to support you. We want everyone to think of getting HIV tested in DC as part of your routine regular health. So just like you'd go to a doctor to get your blood pressure checked and have your pap smear and do all these things that a lot of women do routinely, you should be offered a regular HIV test every time that happens too. Step up and ask for it by asking your doctor or asking your nurse, saying, you know what, are you testing me for HIV? Why didn't you offer me an HIV test? You can help not only make sure you get the services that you need, but also actually change what gets offered to everyone in terms of routinizing HIV testing in medical care settings. Providers are the problem. So my message to healthcare professionals is, you know, it's a new day. HIV is the #1 cause of premature death in Washington, D.C., and as a healthcare provider, it's your job. It's your job to make sure you are offering the person who walks through your door the option to make sure they're not one of those statistics. We sort of perpetuate this myth because it's comfortable that somehow HIV's gone away, it's under control. And I think using personal stories and making them widely available, like through the Living Quilt, to send the message, you know what, it hasn't gone away, but it can go away if we all work together.